Hello, my name is Jenni Homewood and I would like to present this webinar introducing you to namaste care and hand and foot massage using the M technique. To enable me to do this, I'm just going to share my screen with the presentation that I've put together for you, and I hope you find it really informative. As I said, my name is Jenni Homewood. I work for St Helena Hospice, which is in Colchester, and I am the complementary therapy team lead, and I provide therapies with a large team of qualified complementary therapists who volunteer their time. We provide therapies and treatments to our patients, to their family and their carers, and also to those who access our bereavement service. It's a wonderful service to be able to provide, and we see so many benefits come out from those who've been able to have these therapies to help them in their end-of-life journey and to cope with many of the stresses and concerns that they experience while they're going through this, and also after they've lost a loved one. I find that my volunteers are so dedicated, and it's been really tough these last few months as we've been in restrictive times, but we are very grateful that we can offer these services and now offer them in a virtual manner. So for today's webinar, what I'd really like to show you is how you can implement some hand massage and foot massage into your care homes. I want to introduce you as well to the Namaste Care program. There will be some videos that you watch, and I will also provide you with the handouts and paperwork to accompany that. And I hope that you keep in touch and provide me with feedback. I really trust that you will find this very informative and that you'll go away inspired to try something different. So an introduction to namaste care. So as it says there, this is an introduction. We're just going to sort of touch the surface of what namaste care is. It was devised by a lady called Joyce Simard, and she has rolled this out internationally. So today I'm going to focus on end-of-life care for people with dementia. So what is namaste care? It might be something you've heard of before, but what it is, it's a program that was designed by Joyce to improve the quality of life for people with advanced dementia. It was particularly rolled out into care homes and has been very successful. The word namaste is a Hindu greeting, although this isn't a religious program in any way. The word means to honor the spirit within, which encompasses what the Namaste Care program wants to do. And that is to bring honor to people who can no longer tell us who they are, who they were, or care for themselves without assistance. Core elements of a Namaste Care program, which when implemented into a care home, will include a person-centered approach. This is usually carried out daily in a group setting and allocated space. The Namaste Care program addresses issues around comfort and pain management. It creates a calm, peaceful, and familiar environment, mostly because it's done regularly. It engages the person into sensory activities. Aroma is used, soft lighting, memory boxes, photos, drinks and snacks such as fresh fruit and treats, pictures or rolling TV nature screenshots, hand and foot massage, washing the face with a warm soft face cloth and applying face creams, brushing the hair. We call this loving touch. I'm going to show you a video of a care home which has implemented the Namaste program, and I hope you find this very inspiring.
Namaste Care is a structured way of really supporting people who are living with advanced dementia. It originated in the United States, and the word namaste is a Hindu saying which means to honour the spirit within.
Namaste Care is a sensory intervention, so it's really important to pay attention to all the different senses, both in terms of the different things that are used within Namaste Care, but also how people are managing to respond to those.
And with pretty good evidence now to suggest that this Namaste Care improves people's quality of life, and it decreases that sense of agitation that can sometimes accompany dementia. And for other people, it stimulates them, so it perhaps helps us to reach those people who might otherwise be quite locked in to their emotional state.
I think the important thing is that it almost takes people out of themselves, because I think people with severe dementia can get very quiet and withdraw, if you like, so it's difficult to get through to them. So I suppose it's a way of reaching out to people and for them to reach out to the outside world.
My wife Valerie has her hands massaged, which I feel is so important. The human touch is so important.
Coming into the namaste room every morning for quite a number of weeks, it's taken the aggression away.
Namaste Care doesn't take any extra staff. It's about the reorganisation of staff and involving them in doing activities rather than just an activity coordinator.
It's just so warm and it's lovely. Yeah, I would really recommend implementing it in your care home.
I hope you found that really inspiring. I found it's really touching. The things that jump out to me is human touch, time, and you can see from the care workers that they're really finding that very, very helpful in caring for their residents. Let's look at the power of loving touch. Loving touch is being compassionate, slow, person-centered in caregiving. It includes massage of hands and feet, applying a moisturizing cream with calming and familiar scents of the past, and carefully brushing residents' hair, providing a gentle scalp massage. It's crucial that the carer soothes the resident and talks to them, regardless of the resident's ability to speak or communicate. In some cases, it's been found that the resident does reciprocate and communicates back. Joyce Samard sums up the power of loving touch as the foundation of Namaste Care and becomes the thread that weaves the fabric of the day to create a cocoon of love for the residents we care for and care about. There's a real positive impact of having that human touch. By offering the person with dementia a loving touch, specific changes can be seen in them. Decreased agitation as the person's feelings of isolation decreases, more engagement from them, and decreased apathy, improved appetite, thus reducing the chances of malnutrition and dehydration. Improved communication. Some residents have been seen to start talking after being completely mute. Decreased rejection of care as they get comfort and are more receptive to touch, and less pain. Therefore, that makes happier residents, happier staff. Research carried out on the Namaste Care programme, which was done by St Christopher Hospice and the University of Western Sydney in 2016, concluded that when care homes implemented Namaste Care, they noted reduced resident agitation and lethargy, reduced incidence of falls, reduced urinary tract infections, mostly because they were drinking more, increased feeling of uselessness by the family when they visited. Obviously, we're in times when families are unable to visit as freely as they have been in the past, but that will return. And it helps to get the family involved. But currently, if the staff can do that, it's going to be excellent feedback for the families on how their family members are. And it will increase the morale and satisfaction of staff because they feel like they're making a difference. I'm going to introduce to you a hand and foot massage. And the purpose is to show you how to do this with the aim of managing agitation and for settling of residents when needed. I have worked with the Clapton Hospital in the dementia ward by showing the nurses and the nursing assistants how to do hand massage and foot massage, and they didn't have a notable change in the residents settling. Some of them didn't need to have medication to get them settled, particularly at night. They did notice that the ladies particularly liked having their hands done, and it was something that they could show the family members when they visited. Some of the chaps liked the hand, but a lot of them like the foot massage. However, I'm going to show you both, and you can see which resident likes which massage. You may find that they like both of them, and obviously you can alternate that, but that would be important to know how to do both, so you've got two different tools to hand. I think we would all know what the benefits of massage are. You may have had massage in the past, and we know that massage will induce and bring about relaxation. It also gives a sense of well-being and enhanced self-esteem. The psychological benefits are that people have altered mood. They have a lift in their mood. It alleviates the anxiety that they're feeling and the depression that they're experiencing. It also reduces stress and it reduces pain. And pain is mind and body. So it stills the mind and it stills the body. It also offers the chance to talk and listen to somebody and connect in a kind and supportive manner. And ultimately, it will help to induce sleep and bring about rest. Now, when people are wanting to try massage, one of the things they often wonder about is what can they use to massage? And there's obviously concerns about that. I would highly recommend using a natural product if possible. We use grapeseed oil, which is hypoallergenic, and that means it's got no allergy properties, but always worth checking and doing a little patch test if you're unsure. And also, it's not an expensive oil. You can get more nourishing oils. Almond oil is a good example of that. However, it is a nut oil, so it may have allergy properties. It may not necessarily be the allergies of the resident, but it may be the caregiver, or it may be family members or other people about who may be sensitive to nut allergies. So I would just make sure about that. That is why we tend to use the grapeseed oil. You can use it plain, and that's sometimes really useful because some people are really sensitive to fragrance. However, we find that we use lavender a lot. So we use lavender essential oil. Always make sure you get your oils from a reputable company and make sure that they are pure. You don't want an artificial oil going in there. And we always use a ratio of 1%. And that would mean you put 20 drops of the lavender essential oil into 100 milliliters of the chosen oil that you've got. You can keep it in little bottles, label it. You will only need about 5 ml for a hand and foot massage. 5 ml is about a teaspoonful. You can use creams and lotions as well, but you will use more because they absorb into the skin a lot more quickly, and that's not a problem. You just need to make sure you've got more to apply, or you may need to add more halfway through, particularly if the resident skin is very dry. If they have a prescription emollient cream, you can use that, although I do find a lot of those do contain mineral oil, which is not natural. However, they may have a very favorite hand cream or foot cream. It may be something that they were given at Christmas time or birthdays or special occasions that they love. Then use that. It's something that they're familiar with and it's something that they enjoy. However, my most important advice to you is always check for any allergies to any products. Make sure they like the smell and the texture of what you're going to use. And if you're not sure, try a small amount first. Now, when we have massage, I think most of us can relate back to having a massage, firm pressure, working out knots and stresses in muscles. This is not what we're aiming to achieve for the massage I'm going to show you. So we adapt the massage that we do. And this is particularly important for working in palliative care and end-of-life care. The touch that we use is much lighter. I would say it's like stroking a small baby, settling them. Sometimes I say a little kitten, if you like cats or animals, that gentle, soothing stroke. So it's not too light, which is irritating, but it's just light enough to be sort of something that they can feel that will settle them. Make sure it's slow. Make sure a gentle pace. Pace is the speed that we use because we're aiming to calm and we're aiming to soothe. Have compassion and patience while you're doing this because it might take a little bit of time for them to get familiar with what you're doing, but they won't forget your warm, healing hands. And your hands will get warm when you do this, which is wonderful. Simply being there and holding a person's hand can soothe anxiety and increase comfort. It connects you and there will be memorable moments. We often find if somebody is really anxious, then this can be really helpful just to be what we call present in that moment, holding somebody's hand, exchange of warmth, exchange of humanness, kindness, just in a hand holding. And from there, you may be able to then move into the massage. The reason we use the M technique is that this was a developed method of touch for the critically ill and fragile patients, and it's called the M technique, and it was devised by Dr. Jane Buckle. She was able to carry out research on the structured touch, and you can find a lot of her information on her website, and also you can find the research documents and how the specific touch used had a great effect on settling in the mind, in the brain, and this was now accepted as being really useful technique to know and learn. So the M technique is a simple method of structured touch. It follows a set protocol. Each movement and sequence is done in a set pattern. It's not difficult to learn, and a set pressure and also a set speed. So keep the speed really slow throughout. Sometimes when you're learning, you have the habit of kind of going a bit faster, maybe a little bit firmer. Keep each stroke to 3 times. Sometimes a stroke is a selection of moves, but you'll be guided through that on the video. It will help to build confidence and remove anxiety from the giver, because sometimes the giver is quite anxious about doing these things, but I can reassure you this can be done to anybody at any age and by anyone. The pressure and the speed is set. Now we say use a pressure of 3. So if 0 was no pressure, almost like that tickly slight touch, and 10 was crushing, go for a 3. So you can see it's quite low down on the scale, but if you're not sure, just check with them and keep it slow and rhythmic. So remember, it's light pressure, go slow, think of what you're trying to achieve, relax, sleep, settle, and enjoy doing it. You'll find it so rewarding. And what I really recommend is that you record the outcomes after and before the massage and over time. And I'm sure that you will see a massive difference in settling and agitation. So we're going to have a look at the video. It's about 15 minutes long. I will send accompanying handouts, but hopefully you'll find it very easy to follow. I hope you found that really, really helpful to watch. I'm quite mesmerized and quite sleepy just watching it. So you can imagine by doing this and giving this massage to the residents, they're going to certainly feel very, very much more relaxed and settled. Keep going over it, keep learning, keep practicing, and eventually it'll just be something that you do automatically. If you forget a move, don't worry. If you do 2 instead of 1, don't worry. Just keep going and keep the flow going. These are some of the references of some of the information that I've shared with you today. There is the YouTube link to that video about the care home, because there is a longer version. It's about half an hour, and I'd really recommend you watch the whole program of that. There's also a very good book that I've recommended, which I'll recommend at the end, and different websites that will talk about Namaste Care and the effect that it has in care homes. If you want any more information about Namaste Care, any further training on this, then please do contact me. That's my email address at St Helena, and I will follow up any feedback, any questions. If I'm able to, I'll do it on the same day, because I'm very passionate about these kind of things. And do give me feedback. I would love to know how you're getting on. If you have any questions or you're unsure about anything, just get in touch. And do feedback to the medical team. I know that for many care homes who have implemented this, has made such an enormous difference, and particularly when inspection takes place, it just shows a different level of care, and I'm sure that you'll find that this is something that will enhance what you're already doing. As you know, we are currently in restricted times, and there are different protocols in place for different care homes. So you just need to adapt into those protocols. And once we are living in freer times, then hopefully we'll be able to do this face-to-face rather than on a video way. But in this way, at least we can reach a lot more people. So do stick to your protocols, do wear PPE. Wearing gloves doesn't make any difference. It feels a little unusual at first. Use the nitro-free gloves, because the oil can make them a bit sticky otherwise. And I'm sure those are already provided by the care home. If you don't need to wear gloves, then obviously, you can do it skin to skin, but I would imagine in today's current climate, it's all gloves and PPE, and we can still do this with that in place. Just some further links and resources about Namaste Care. You've got the Namaste Care website. You've got St Christopher's Hospice, who does produce a program toolkit. We would recommend further training, because I just think you learn a lot more when you're doing things face to face, or even by a team meet where we've got lots of people who can ask questions and respond. King's Fund have also produced a good document, and then you've got the Namaste Care International website as well. The 3 books that I would recommend is Joyce Samad's book, Namaste Care, a new one that's just been produced by Nicola Kendall, Namaste Care for People Living with Advanced Dementia, very practical. I think it was published last year, 2020. So highly recommended, really good practical advice, and from current care homes, so good case studies in there as well. Luke Tadder has written about embracing touch in dementia care and the importance of that. All of these books are available on Amazon, but you can also source them in other areas. So I'm not promoting Amazon. I just know that that's a really useful place to find them if you really want to get into reading more about this. So thank you. I hope you've enjoyed that. I hope you found it really, really beneficial. I've enjoyed sharing this with you. It's been quite a long process putting it all together. We are doing it on home computers, but with expertise. And actually, it's just about sharing good practice. It's about putting things into place that we know will make a difference. So do keep in touch with us. So I hope you found that really helpful. I think this is about the 6th take of this that I've done. So I should know it off by heart, shouldn't I? But do keep in touch with me. Do ask questions. And if you'd really like to know more about Namaste Care, we'll be delighted to, even at this stage, look at how we can produce this for you. But certainly it's on our agenda as part of our teaching and learning. And I really hope that you find this makes such a difference to you and to your residents. So I wish you well, take care, and all the best.